The new MPOX strain is more serious than you think, and I'm here to break down exactly why it could be a global health emergency. The Democratic Republic of Congo is facing a serious health crisis with a significant MPOX outbreak. The numbers are alarming. Over 13,700 cases have been reported this year alone. Tragically, over 450 people have lost their lives to the disease. The virus is not confined to the DRC. It has spread to neighboring countries. Burundi, the Central African Republic, Kenya, and Rwanda are all reporting cases. The situation is so dire that the Africa CDC has declared MPOX a public health emergency across the continent. This outbreak is a stark reminder of the devastating impact infectious diseases can have. MPOX, once considered a rare disease, is now a growing threat to public health in Africa. The international community must come together to support affected countries and contain the outbreak. Failure to act decisively could have far-reaching consequences. The outbreak is putting a strain on healthcare systems already grappling with limited resources. The international community must step up and provide support. This includes financial aid, medical supplies, and personnel. The recent surge in MPOX cases is particularly concerning due to a new strain of the virus. This new strain appears to spread more easily from person to person. Scientists are working tirelessly to understand why. Early findings suggest changes in the virus's genetic makeup might be responsible for its increased transmissibility. Health officials are worried. A more transmissible virus means the outbreak could spread more rapidly and widely. This is raising alarm bells at the World Health Organization. They are closely monitoring the situation. The WHO is constantly assessing the risk to global health. Their goal is to prevent a pandemic. The emergence of this new strain underscores the unpredictable nature of viruses. Viruses mutate. Sometimes these mutations make them more dangerous. This situation highlights the importance of ongoing surveillance and research. We need to stay one step ahead of emerging infectious diseases. While the current outbreak is largely concentrated in Africa, the potential for global spread is very real. International travel and trade make it easy for viruses to cross borders. The WHO has issued travel advisories to inform travelers about the risks and precautions to take. The WHO is working closely with countries around the world. They are helping to strengthen surveillance systems. These systems are crucial for detecting and responding to outbreaks quickly. The WHO is also providing guidance on response measures. This includes how to isolate cases, trace contacts, and manage outbreaks effectively. The global community must learn from past outbreaks. We know that early detection and a coordinated response are crucial for containing infectious diseases. Failure to act swiftly and decisively could have devastating consequences. Recognizing the symptoms and preventing transmission. Knowing the symptoms of MPOX is crucial for early detection and treatment. The virus typically starts with flu-like symptoms. People may experience fever, headache, muscle aches, and fatigue. These symptoms are often followed by a rash. This rash is characteristic of MPOX. It develops into fluid-filled blisters that eventually scab over. MPOX spreads through close contact. This includes direct contact with an infected person or animal. It can also spread through contact with contaminated materials like bedding or clothing. The virus can also spread through respiratory droplets. This usually requires prolonged close contact. Understanding how MPOX spreads is essential for prevention. Simple hygiene measures can make a big difference. Washing hands frequently with soap and water is crucial. Avoid close contact with people who are sick. If you experience any symptoms of MPOX, seek medical attention immediately. Combating the outbreak: prevention, vaccination, and global cooperation. Combating the MPOX outbreak requires a multi-pronged approach. Isolation is crucial. People who are infected with MPOX need to isolate themselves to prevent further transmission. Contact tracing is also vital. This involves identifying and monitoring people who have been in contact with an infected individual. Hygiene measures are essential. This includes frequent hand washing, covering coughs and sneezes, and disinfecting surfaces. Vaccination is a powerful tool against MPOX. Efforts are underway to secure vaccine doses for affected populations. This outbreak highlights the importance of global cooperation. International collaboration is essential for sharing information, coordinating response efforts, and developing effective vaccines and treatments. By working together, we can control this outbreak and protect global health.